Can everyone hear me?
Yes, we can hear you.
Oh, perfect. Did I just do my whole speech and I had myself muted? Oh, no. Okay. Sorry about that. Working remotely today. So good afternoon, everybody. Welcome to the bi-monthly EMAT webinar. Today's webinar will focus on COVID-19 cash, optimizing fund, and minimizing risk of de-obligation. The EY team will present on COVID-19 funding sources and process of retaining funds received. I'm Jennifer Suter. I'm one of the co-chairs of the EMAT Training Commission, or Training Committee chairs. And we have a few housekeeping rules to take care of before we get started. Everybody on the webinar is currently muted. We are going to hold questions until the end, but feel free to enter into the chat box as we go along. We will be recording today's webinar, and it will be available a week on the EMAT website. Welcome to all EMAT team members, and thank you for attending this webinar. For those that are non-EMAT members on the webinar, we hope you consider joining. Today, we're lucky enough to have Brittany Ladzekpo and her colleagues from EY. Brittany is a senior manager at Ernst Young EY in the Insurance Federal Claim Services practice in Houston, Texas. She has over 7 years professional experience in public accounting, internal controls, as well as assisting law firms and companies with internal investigations, insurance claims, preparedness, and regulatory compliance. And Brittany will be introducing other members of the EY team. So Brittany, whenever you're ready.
Yes, I will. Thank you, Jennifer. Welcome, and thank you for all the participants for joining today's webinar session. Like Jennifer said, my name is Brittany Ladzekpo. I'm a senior manager in the forensics specializing in insurance and federal claim services. And I will be one of your presenters and moderator for today's session. So we have an hour slot, 25 minutes for presentation and 15 minutes for question and answer. So with that, I'll jump right into some quick introductions. I will first turn it over to Greg to provide some background and introduction of himself.
Thanks, Brittany. Greg Eaton, Executive Director based in Chicago. I'm supporting across the country hospital systems in their recovery from COVID, as well as some states and cities and counties. The background, from a background perspective, retired from FEMA. FEMA had two roles. I was a federal coordinating officer and FEMA Region 5, which is based in Chicago and responsible for the about 5 states in the upper Midwest, but ran presidentially declared disasters across the country. Second role, I was the Recovery Division Director in FEMA Region 6, which is your region, and Texas and their surrounding states. With that, I'll kick it over to Branch.
Thanks, Greg, and good afternoon, everyone. Branch Strickland, a senior manager also with the Insurance and Federal Claims Practice out of the Los Angeles office. I've been with EY for just about 3 years, and prior to joining the firm, I worked for the City of New York for 10 years, both in their Office of Management and Budget, and then as Director of Finance for the city's Emergency Management Office, and was there for the response and recovery for Hurricane Sandy. And currently part of the IFCS team assisting cities and territories recovering from both COVID and some pre-COVID disasters, including the hurricanes Irma and Maria. With that, I will turn it over to Linda for an introduction for her.
Thank you, Branch. Hi, I'm Linda. I'm also out of the Houston office with Brittany. I've been in the Insurance and Federal Claim Services for the last 7 years and have worked on both CDBG-DR type grants, COVID, and almost everything under the sun, but not anything close to Greg. So let me go ahead and pass it back to Brittany, who will lead us off into the next slides.
Thank you all for those very nice introductions. So we thought it would be great. I know we've all been living in this COVID-19 pandemic for quite some time now. So we thought it would be good to really outline the various sources of COVID-19 funding, provide some scenario-based examples, and really get thoughts and insights from the presenters on ways to optimize that funding, and then wrap up the presentation with ways to minimize the risk of de-obligation. Want to make sure once you have your money, that we ensure that money is in hand. So with that, I'll start off with outlining the various sources. There's more than one source of COVID-19 funding available, but we thought we would highlight the 4 main groups. So the first one being the Rescue Plan Act, that is 1.9 trillion funding. We have CARES, which is $2.3 trillion of economic stimulus bill. We have HUD that provides funding from a disaster recovery perspective, which is DR. And then we also have it from a CV perspective, which is coronavirus. And then lastly, which offers assistance from public assistance and hazard mitigation. So we're going to turn it over to Greg to actually tap into the first bucket of funding, which is ARPA, and outline some of the costs of how you can use that those funds. Excuse me.
Thanks, Brittany. As we look at the American Rescue Plan and what it's the funding it's provided, and the key component that we're talking about is $350 billion in the coronavirus state and local fiscal recovery funds. It really has funding objectives, 4 of them, that is to support the urgent COVID-19 response efforts. 2, replace lost revenue from the public sector standpoint, support immediate economic stabilization, and then address systematic public health and economic challenges. So as we look at just the broad categories here of where you can spend ARPA funding, and it is very broad. And the first is public health expenditures. This is in response to COVID-19 mitigation efforts for COVID-19, would include medical expenses, behavioral health care, premium pay for certain workers, and really, again, very broad brush from a COVID-19 response standpoint. The negative economic impacts caused by the public health emergency. This includes the economic harms to workers, to households, to small businesses, and then impacted interests and certainly the public sectors as they look across this funding and how to best implement the overall funding. And then the public sector lost revenue, both on the maintenance pay-go infrastructure, pay-as-you-go infrastructure. To the extent you have a reduction in revenue, and then lost revenue measured in years 21 through 24. Then a couple things that are unique to this as opposed to other COVID funding sources is more building and adding capacity in broadband infrastructure and expanding access to the broadband internet, improve access to clean drinking water, and support vital wastewater and stormwater infrastructure. So again, very broad brush as far as what you can use this money for from a priority standpoint at the state and local level. I think one of the things that really has been best practices of what we're seeing is really that strategic effort by communities and looking at the different funding sources and how to best implement this funding source in harmony with all the other funding sources, and building that strategy is really a key component, because you certainly don't want to fund things here that could be funded through some other source, like public assistance, the branch is going to talk about, or hazard mitigation, or some other source. The time frame, from March 3 of 21 through December 31 of 24. And then as far as the funds being obligated, and then expenses needed to be incurred by December 31 of 26. So again, considerable time frame, much broader than the other funding sources. The reporting, we're coming up on the first reporting period here in just a couple of days. or for some, could be second for others in January 31st. Reporting, and there's a fairly lengthy list of what is being reported in each of those quarterly reports. But as you look at the reporting, and just the compliance component of this, 2 CFR is very applicable across the board, and all the different components of 2 CFR. So as you look at the broad brush efforts that can be funded through this, compliance with 2 CFR is critical, and all your reporting data, and then again, it is fairly lengthy as far as how and what to report. And then undoubtedly this will trigger single audit requirements, as the majority of communities would have over the 750,000. So again, from a compliance standpoint, if you aren't typically involved in the single audit, meeting those single audit requirements, this will certainly put you into that category. And another key component is if you have subrecipients, monitoring those subrecipients, again, in compliance with 2 CFR, and making sure that you're managing and monitoring those subrecipients to meet the overall compliance goals, and your goals and what you are funding through the ARPA funding. Again, very broad brush, a significant timeline in which to expend those funds. But again, compliance is a key part of this, and we'll talk about more at the end. So with that, I will pass it on back to you, Brittany.
Thank you, Greg. Linda, you want to take us to the CARES Act and provide some color and detail around that?
Yes, I can. Thank you, Brittany. So with the CARES Act, or long, the Coronavirus Aid, Relief, and Economic Security Act. This was passed for $2.3 trillion back in 2020. And for this act, it was covering the Coronavirus Relief Fund, which is also known as the CRF, or the Provider Relief Fund, or PRF. And so those were the 2 direct funding categories under CARES. And aside from that, there were also indirect funding that were used to either piggyback or bolster other existing grants during COVID. And then once we go into this slide here, we're going to get into the next types of, or the differences between the 2 funding categories. So for under the CRF, $150 billion was allocated to both state and local governments. Under this, we also need to see expenses that are necessary and unbudgeted for COVID-19, as well as also see through that these expenses occurred within the March 1st, 2020 and December 31st, 2021 guidelines. And as usual, we do have quarterly reporting due until October of 2022. So under the PRF funding, $186.5 billion was obligated for support of hospitals and other healthcare providers. These funds do expire back in December 31st of 2021, and there were 4 general distributions for under the PRF, and they also had other targeted distributions if the entity qualified. So a little broad brush on that as well, but we're going to go ahead and move into HUD Community Development Block Grant Programs, or for short, CDBG-DR, or newly created CV, which is for coronavirus. So under this act, or this type of block grant, it usually covers disaster relief, long-term recovery, restoration of infrastructure, housing, and any economic revitalization. The difference between this grant, though, is that the entities usually are state and local governments, and they do need to normally meet a national objective, which is usually on the side of the low income, moderate need, or for slum and blight, or to meet a community development need for a particular urgency. And also to add on to that as well, the difference, key difference here as well is that the entity does need to have an action plan So they do need to follow that action plan for the funded types of programs that they intend to use the CDBG-DR grants with. So for the coronavirus funding, 5.5 billion was obligated for this type of funding, which covered also metropolitan cities and urban communities. Oh, thank you, Brittany. At least 70% of the grant must be used for activities to, of course, cover the LMI population or one of the other two national objectives. These activities also included, very similar to CDBG-DR, public service activities, housing related, public improvements, activities to acquire real property or economic development activities, and also general administrative and planning activities. And again, these do need to follow their action plans. So that's something to note there, as well as following the national objectives. And with that, I will go ahead and hand it back to Brittany, who will lead us on to the FEMA PA section.
Thank you, Linda. And Brent, I'm going to turn it over to you to tap into the FEMA PA section.
Thank you, Brittany. And as we go into the FEMA Public Assistance Program, this is the same public assistance program that most of you, I imagine, are probably familiar with, either from a prior disaster or even just working within the last couple of years that the pandemic has been going on. Obviously, there have been some changes to the public assistance program specific to COVID. We have a small brief summary of the major ones, and they really do focus around the application process. You can apply directly with FEMA without relying on FEMA or recipient staff, the COVID-19 streamlined project application, and then some documentation requirement reductions for those small projects. So I think we won't dive too much into FEMA public assistance, as this has been one of the historical disaster recovery programs, but I think, Brittany, if we can go to the next slide, we did want to go over just the general categories specific to COVID that this type of funding could cover, and then some of the questions and best practices we've been seeing from FEMA as folks have been going through the public assistance process with their COVID recovery reimbursement requests. So in general, eligible activities and programs do include the management, control, and reduction of immediate threats to public health and safety. That could cover anything from those emergency operations center EOC costs down to the technical assistance for emergency management and control of those immediate threats. Obviously, emergency medical care is a significant aspect of FEMA public assistance for the pandemic, covering from the medical treatment to infected persons to medical emergency medical transport. If we could go to the next slide. Medical sheltering, this is the non-congregate sheltering programs that a lot of states have developed into their sheltering systems that will have been revised per COVID guidelines, since the old way of sheltering folks in a congregate setting really doesn't quite work in a pandemic setting. And then probably one of the other larger categories are the consumable supplies, the PPE, the masks, the other general supplies that were really used to facilitate the COVID response and recovery. What we are seeing from FEMA are, unfortunately, a lot of questions about this as these reimbursement requests are going through the process. I think it comes from two different aspects. I think the first, this is a national pandemic, so you do have a lot of entities that have never had a public assistance claim now being eligible for one. So before, when it was all focused on your more typical natural disasters such as hurricanes, wildfires, there would always be, I think, a common set of departments that would be involved with the response, and they would have eligible costs. Now that this is really a national pandemic, you are seeing a lot of departments and agencies having to put together these claims that just really aren't used to the whole FEMA process. And I think the other part is, FEMA is also dealing with this novel pandemic response. And so as such, they have a lot of questions on the types of activities that recipients and subrecipients are doing and the documentation that are being provided. So what we are seeing, certainly the more context you can provide on why these costs were incurred and the pandemic relation to these certainly helps FEMA as they go through the documentation or review these as they make a determination if these costs are going to be eligible. That goes a long way. And then the other, I think, major item that we are seeing are really that dividing line between increased operating costs that FEMA unfortunately typically doesn't pay for and the COVID costs that the pandemic has had all these departments incur. That is a fine line. Working from home, the telecommuting, all of those types of expenses, FEMA is taking a really hard look at those to kind of figure out which bucket of costs it goes into, whether it's a COVID response cost or an increased operating cost. And it all goes back to that level of documentation and additional context that you can provide as you're putting together your FEMA public assistance claims. I think, Brittany, we might have lost the PowerPoint there.
Yes, I can go ahead and screen share.
Oh, we might have lost Brittany. That would be great. But I think just moving on to the Hazard Mitigation Grant Program. This is another grant program. I think if we can jump over to slide 18.
Yes.
Thank you very much. So this is new as of August 2021 and really represents another bucket of funding that is a potential type of funding that can cover either, while these funds don't have to be tied to the disaster, it certainly does provide an additional source of funding when looking at the overall COVID recovery or other priorities of a recipient. Here we have an overview of the key considerations, challenges, and leading practices. I think the key considerations: don't start a project until you do get that FEMA approval. I think that's really critical. These projects do require an adopted hazard mitigation plan. So if you don't have one, certainly make sure that that is on the radar to be completed. And then always looking at current events, because these grants will be highly competitive and it will be dependent on the state to determine which projects they will be funded. This is something we do advise to take a look at really what the state is doing and what projects they might be prioritizing, and then putting together that wish list of both shovel ready and longer term projects that can be completed within the 36 months of this program, and making sure that that aligns with the state objectives, so that your projects hopefully can be at the top of the line when it comes to funding considerations. I think if we can move to the next slide. So just some examples of some projects. We have some pretty straightforward mitigation projects. This could be from flood mitigation, wind retrofit projects, or backup generators. There could be hazard mitigation planning. This could be updating the mitigation strategy, or really planning for future resilience and disaster recovery goals. And then the other thing to note with this funding source is that there is support for management costs to manage this type of funding. It's 10% for recipients and 5% for subrecipients. So that is certainly another area that can be used for support there. I think then we can move on to our funds interplay section. And Brittany, I'll hand it back over to you.
Thanks, Branch. So now that we've outlined the various sources of COVID-19 funding, we thought it would be good to provide some scenario-based examples that we can get some thoughts and insights and perspectives from the presenters based on their experiences. So Linda, can you go to the first scenario? So I won't read the exact slide, but I'll highlight the key points, and then I'll ask the presenters to just chime in with their thoughts and their perspectives. So for this scenario, we have a healthcare subrecipient that hired contract nurses to assist with COVID-19. They utilized force account labor, as well as they purchased PPE materials. Now they submitted all these costs to FEMA for reimbursement, but they were denied force account labor, and they only received the 75% cost share because that was the percentage at the present time. Now, if we bring that current with the 100% cost share, what other options does this healthcare provider have in the unused CARES piece of that 25%? And I'll open it up to Linda and Greg, whoever wants to provide their thoughts.
I can start. As far as the force account labor, what is eligible for forced account labor, and this is your own staff within the hospital in this case, is the overtime. So the regular time is a budgeted component of what the hospital system would be doing every day in the course of business. But the response to COVID would be that overtime component. So overtime in response to COVID. The cost share has changed. It's 100% through April 1st of 22. So if you did not receive all the federal share, you should have received all the federal share through your project worksheet that was submitted to FEMA. So that would correct itself. But then the regular time, that could be submitted in that could be considered for under the Provider Relief Fund or certainly other funding sources there. So there's ways to look at that as well.
Thank you, Greg. Any other thoughts from the others? Linda or Branch? No? All right, we'll go to scenario 2. So this one is where a subrecipient is just really seeking additional funding for admin costs. What options of funding does a subrecipient have to gain admin costs?
And I can take this one, Brittany. I think this is a very common question that we've received, particularly with all these new sources of funding. It can be a lot to add on to the existing management and administrative functions of everyone's respective departments. Each of the funding sources typically does have an allocation for management and administrative costs, whether it's FEMA, CARES Act, and there are certainly a variety of ways to procure that support. Obviously, getting contractor support is certainly an option. Even bringing on additional full-time or part-time staff could be an option. I think the thing there to keep in mind is if you do have an existing employee or a new employee that's working on this funding, really making sure that you do track their time. If you have someone that is working on both, say, FEMA funding and CARES Act funding, and you put some of their hours that they're working on CARES Act in a FEMA reimbursement package, FEMA will probably highlight that and say, this really needs to be applied to the CARES Act management allocation rather than FEMA. So if you are going to be using some existing staff time, just making sure that you do track their hours and really charge the appropriate funding source for the activities they're working on is pretty important.
And I think a key point to highlight here is that from a FEMA perspective, while the management cost is 100% eligible, it is tapped out at the 5% of the obligated projects. Whereas from CARES, which is a little bit more broad, 100% of that is going to be eligible for reimbursement. So just think about that when you're trying to optimize your funding. Linda, I think we can go to scenario 3. So this is a case where a subrecipient has incurred expenses from a variety of different areas. Overtime costs, they purchased some signage, they rented laptops, and of course they utilized PPE. So what options are available for this type of scenario from a funding perspective?
And I think this is another great question, and one that is I think have seen quite a bit. And I can certainly go through what FEMA public assistance may or may not pay for. And I think the second one, in terms of the signage, this would most likely be eligible under FEMA public assistance, as is the PPE from warehouse supplies. As we mentioned before, you know, the IT, you know, anything in terms of working from home, whether it's those laptops, renting or purchasing laptops, or the IT department incurring overtime in support of regular departmental operations, that most likely is not going to be FEMA eligible.
Greg, did you want to provide any more thoughts on that one?
And just all the other funding sources, they as you look at this, it really is part of that strategic component of what you're trying to fund. Branch talked about the public assistance piece of that. The CARES Act is potential. There's FCC grants that is certainly beyond the scope of today, but the for some of the IT components, some of that technology may fit into that grant if you received any funding through that. And then on the ARPA side, it could fit under there too. So again, putting that puzzle together with all the different pieces and what fits best in your overall situation on what thing should be funded by what source. Brittany, back to you.
Thanks, Greg. Great point. So in this particular situation, continue to stockpile PPE, but we do know from a FEMA perspective that they have the 60-day burn rate, and the applicant wasn't able to distribute all the remaining PPE. So what piece, any or part of funding, is eligible in this scenario?
So I'll go ahead and take a stab at that question. So unfortunately, if you have a 60-day burn rate and it has already passed, you really are only eligible for about a $5,000 salvage value. So while unfortunate, but we do try to instruct the applicants to make sure that they're spending all their stockpiles while they can within the 60-day burn rate, because that is very important, because of course we don't want to leave money on the table. So we want to make sure that applicants are aware of that. And then also for the scenario-based question number 2 response, if the applicant has not made a claim for the funds, then the reimbursement, the unused PPE past the 60-day burn rate is not eligible for any sort of reimbursement at all. So it's very important to try to figure out what it is that was used for PPE and kind of get that together so you can get as much of the reimbursement as you can.
Thanks, Linda. And we actually see that quite often. I know a lot of applicants are buying because we're still in this COVID-19 pandemic, but just want to be cognizant that you are reviewing and doing your counts and ensuring that you're not just buying at an excessive rate, that you are slowly in the inventory stockpile that you have. All right, scenario 5. So different type of question. So this is a climate change crisis, and they're trying to update their hazard mitigation plan to include some measures for COVID-19. Well, not specifically COVID-19, but for any global pandemic. So what options are available in this scenario?
Yep, and I think in this scenario, and this goes back to the hazard mitigation grant program that we reviewed just a little bit ago, that could be certainly a funding source that would be appropriate to pay for this plan update.
And as we all know, there's a timeline on those plan updates. They're very expensive to pull all that together. So the hazard mitigation itself can be a funding source for there, but there are other planning type grants that are very applicable in this to fund that component. I know as you look at your hazard mitigation plan and modifying it to include pandemic, but you're really, it's a baseline approach of including all hazards in the and looking at all threats to your community and incorporating in this plan.
Thanks, Branch. Thanks, Greg. This is the last scenario. So in this instance, an applicant incurred labor overtime for administering tests and vaccines. And so the subrecipient would like to claim costs for the additional overtime. What available options are out there for the two tasks? One for administering the vaccine and for administering the test.
I'll go ahead and answer that question, Brittany. So labor is a very tough question and tough expense category to review as it relates to trying to account for overtime labor that is in excess of the regular time. So for labor time, the overtime is eligible, of course. However, only an offset can be reimbursed if overtime expenses is greater than the revenue received for vaccines. The subrecipient must segregate vaccine-related costs from COVID-19 and compare that against the vaccine revenue. So a little dicey in the labor category, but this is very important as we're not trying to duplicate any sort of revenue or other funds that were received for the labor portion of the vaccines. I'll go ahead and leave that back to Brittany.
I think that wraps up. And Jennifer, I know we were talking about leaving questions for the end, but if anybody has questions now, let us know and we can chime in with those. If not, we'll continue on with the presentation. All right, I think silence is golden in this scenario. So we'll continue on with the presentation and I'll hand it over to Greg to outline some ways to minimize the risk of deobligation.
Certainly. Next slide. Thank you. As we look at just minimizing the risk of deobligation, really you're starting this process with the end in mind. And so considering the documentation and supporting all the costs going through project formulation all the way through closeout. The goal certainly is to keep the funding that you've received. Nobody wants to pay money back. And there's several places through the process that there's checks and balances that could lead to deobligation. One, in just the closeout process. And submitting your project to the state and then ultimately to FEMA for your final review. The project is reviewed again at that point. Certainly, from a FEMA perspective, the Department of Homeland Security Office of Inspector General provides oversight in auditing projects. All these funding sources, the CARES Act, ARPA, they all come with an oversight component. Within the law, and led to other OIGs that you may not be involved with on a regular basis, but through these funding sources may be involved with. HHS OIG or Treasury OIG, all these different components, all these Office of Inspector Generals as you through the life cycle all the way to closeout. I'll start with the leading practices and just your contracting and procurement protocols. That really is one of the biggest risks to having funding deobligated. 2 CFR 200 has very strict procurement requirements, and understanding what those are. And as you look at the Office of Inspector General, the majority of audits are related to procurement. So that's certainly one area that really you spending an additional time and looking at that, and make sure you're complying with 2 CFR 200. And then having contracts in place prior to the event, that conform with federal standards, is certainly a leading practice, in that you've gone through that federal compliant procurement process. So when an event happens, you've already done that step and not at risk for de-obligation through your contracting process. Complete and accurate documentation, spending considerable time with that, and make sure you're supporting all your costs. And then can't emphasize enough, it really is a partnership, both with FEMA, the state, and then our local communities and the applicants. So that communication across that those three entities is really critical and important to success. As we look at documentation, again, your purchase orders and contracts, being able to support that, and then invoices and proof of payment, all critical in supporting every penny, all the way through the process until closeout. Talked about procurement there and adherence to 2 CFR 200. There is provisions for emergency procurement, but then there's rules for that, both in requirements in that, both within 2 CFR 200, but also the state, and then your own procurement procedures and requirements, and making sure you adhere to those. And then there's, from a contracting standpoint, there are very much prohibited contracts and structures of contracts into CFR 200. So cost plus and those type things are very much a no-no when you get to working through federal grant regulations. And then monitoring of costs. This is within your organizations, is just continuous oversight and monitoring of all your contracts, labor, your documentation. If you have subrecipients, a very important part in making sure you're monitoring them, which is a requirement if you do award funding down to the subrecipient level. And then your just internal controls, and making sure you're being able to document and appropriately spend money in federal awards, and very valuable in spending and recovering costs across the COVID environment. But also comes with a significant amount of effort in order to appropriately document and have the internal controls in place. And then just accurate coding and separation of funding across the different grant sources, and then other state, other foundation funding, and especially in COVID being a very unique environment, and across the different funding sources, plenty of opportunity for duplication of benefits, and really that strategy of funding is critical in avoiding a duplication of benefits, and ultimately being able to keep the money you received, and appropriately put it to use for the intended use in the response and recovery from COVID. With that, Linda, I'll turn it back to you. Oh, sorry, Brittany, I'll turn it back to you.
I think that's our last slide. So that wraps up the content of the presentation today. Jennifer, do we have any questions or any questions from the folks on the line? Anything in the chat as well?
We don't see any questions at the moment, but again, thank you to all our speakers. So we will now open it to questions. Feel free to come off mute or add your questions to the chat. I'm not seeing any questions come up. I'll give it one more second. All right. Well, thank you again to our speakers. Again, for those that are on the line, we will be posting this. We have recorded it and we'll be posting it to the EMAT website. So thank you again to Greg, Brittany, Branch, and Linda. Just an announcement, we will invite you to our March webinar where we'll be hearing from Alexandria Cruz from Miami-Dade OEM on the 2021 Surfside condominium collapse. So thank you to everyone for attending today. And again, thank you to our speakers.
Yes, thank you all for attending today's presentation.
Thank you.
Thank you.
Take care.